if you have any real optimism that the political tone, the political ability to move forward on this, in whatever direction that may be, is different now in 2008 than in the many years past when you've been at it.
Yes. I think that it can be different. Right now, there's a lot of partisanship. There's no question about it. But I think it can be different under a new administration and a new opportunity. And I think there are three basic reasons for this. It's what we started to talk about earlier, which is the public is very worried. Mm-hmm. And when I say the public, I'm not just talking about low-income people who can't afford health insurance. I'm talking about the American middle class,
who see this very much as an economic issue.
They see it as an economic issue. They see it as an issue that's threatening their well-being, their ability to have a secure family life, and they're worried about their kids. Most of their children are not covered either. And so what you have here is a middle class that's worried and to a certain degree angry. And when the American middle class gets worried, I think politicians take note. The second reason why I think we can have a new day is, as I said before, business. What's happened back in 93 and 94 during the Clinton effort to reform healthcare, business was basically saying, we can take care of this. We can take care of our employees. Let's not get government involved. And I think they've changed that tune. And what they're saying now is, we can't afford this any longer. We're not competitive. We need relief. We need something to happen to fix healthcare so that it's affordable for us and our employees and the rest of the country. And then I think the third reason is that the problem is so much worse. There's a certain thought in our country, and unfortunately it's probably partly true, which is we only seem to be able to do anything when there's a crisis staring us in the face. I think there is a crisis. The quality of care, the 47 million people uncovered by health insurance, all the different things that we've talked about. So it may be that these things coming together can push us forwards towards solutions.
Another question I wanted to ask you in this kind of political context is this, and it's something I've asked others involved in this series of interviews. Which do you think is the better way to go, and which is the more practical way to go? Incremental or big and bold?
Big and bold, transformational, wipe the slate clean and start all over is the better way to go.
More practical?
The more practical way to go is incremental. And the reason for that is obvious. I mean, Congress, the administration, our system can't deal with really transformational change in a system as complex and as expensive as this one. So here's our great challenge, I think. We're going to have to do things in reasonable, bite-sized steps. But we're going to have to do it sequentially so that it makes sense, so that B follows A and C follows B in a sequential, logical pattern, and not just throw things at the wall. So I think the practical answer is we're going to have to figure out a way to find a pathway to change so that we can do things in proper sequence and make it work.
When you do things in what you call proper sequence, doesn't experience tell us, though, that the longer it goes on, the more opportunity there is for more, what am I trying to say here?
You're trying to say that stuff happens.
Stuff happens, right?
Indeed. Stuff happens, and it can happen here. The president could get distracted. The Middle East could flare up. A million things can happen. And the longer it takes, the more danger there is that we go off the tracks. I think that's true. And that's why, ideally, in a perfect world, we would basically draw up a new system.
Do you think at this moment that Congress has the ability to approach this in the right framework, and that is that instead of looking at the piece parts, to look at the whole picture?
I think it would be hard. It's very hard the way we're set up with the political infighting we have, the jurisdictional disputes that we have, and let's face it, there's very, very little money to fix anything right now. I mean, we've got deficits and debt as far as the eye can see. And so the first question we have to ask is, what really is feasible? And the second question we have to ask is, who's the president and who is the Congress? A president may approach this differently depending on who he is or she is. And certainly Congress, if we have a filibuster-proof Senate, that would be one thing. If we don't, that would be another thing. So there are a lot of moving pieces here to this puzzle.
And you're right, of course, at this moment, we don't know who the president will be, what the Congress will look like. But we do know, as you suggested, that the economy is not in great shape. And how much does that diminish the chances for change?
Yeah, it's more than the economy. Right now, we're in an economic downturn. We'll come out of that. But it's more than that. It's the deficit. It's the debt. It's the fact that there's just not a lot of money to do the kinds of reforms that are necessary in this country. And, when you look at healthcare, it's a big, complex, costly system. There is money in the system to fix it, but it will require upfront investment for a return on investment later. So to give one really good example, we need evidence-based research. We've got to figure out what works. There are lots of estimates right now that half the care that's given is inappropriate or inadequate. Now, how will we do this? Well, we're going to have to invest in some kind of a system that's walled off from politics so that we can figure out what actually works in terms of medical devices, procedures, drugs, and so forth. That's going to take some money. Health IT will take some money. All these things will cost money with big payoffs down the road.
Maybe not even for a decade, which is a hard thing for politicians to accept. They want immediate results that they can take home.
If we could fix this, it would have been fixed. I mean, this is a very tough.
It's tough stuff. We've been talking mostly about action, potential action at the federal level, but there is so much activity at the state level. How much hope do you have that that's where real reform can come from?
When California healthcare reform failed, the lesson that many people drew from that was the states can't do it. And other people looked at Massachusetts and said, well, this isn't working as well as we had hoped, and therefore the states can't do it. It has to be resolved at the federal level. But I think we're seeing a different pattern right now. If you look at Minnesota or Illinois or Iowa, hopefully Wisconsin, even Massachusetts is making some progress. Little bits of the Schwarzenegger bill are now being brought forward in incremental form. I think the lesson is more complicated than that and more nuanced than that. I think the lesson might be the states can make progress, but we still need some kind of a federal overlay. Things like evidence-based research and dealing with ERISA and other things that only the feds can do. But I don't think we should draw any conclusions that the states can't do it. There are a lot of good things happening right now at the state level.
What do you think has been proven to work the best at the state level?
Well, they've been able to add children and adults to the roles of those who are covered by health insurance. There have been
at a greater cost than what was anticipated, though.
Yeah. There have been cost containment successes. There have been bulk buying partnerships to make drugs cheaper. There's nowhere where they've hit a 10 on a 10-point scale. But I think our people think that they've been hitting 8s and 9s. And a triple is worth something in baseball, and it's worth something in healthcare reform, too.
I do have one final question for you. If the sequential approach that you were describing a few minutes ago happens, what would be your pick for the first piece in that sequence?
I think, again, given the fact that we're talking about what's practical, I think we're going to have to do some things that are going to be, they're going to help to bend that cost curve. They're going to help to contain costs, because that's what's hurting everybody right now. And so I think that health IT would be important. Figuring out how to pay for performance instead of just procedures would be important. The evidence-based research I talked about earlier, trying to make drugs more affordable. There are a series of cost issues. But the thing that makes this really difficult is that there are other issues as well. I mean, we need to insure our kids and so forth. So I would put cost high on the list, but I don't think you can just deal with cost alone.
Okay. Bill Novelli of AARP, thanks so much.
Thank you, Jackie.
Great.
The Kaiser Family Foundation presents Health08.org, election news, analysis, and events.